Thank you so much for having us. We are excited to be here and really excited to kind of share the things that we're doing over at our Thompson Autism Center at CHOC. I'm going to go ahead and start sharing my presentation, and hopefully I'm pretty loud, so hopefully you can hear me as well.
I can hear you fine. I just wanted to say one thing to our listeners. If you have a question, please put it in the chat, and then either Ellie or I will introduce Elissa interrupt Elissa if it's necessary. But what we'd like to do is maybe at the end, I'm sure we'll have time at the end for a discussion. So we'll go into gallery mode and everybody can ask their questions. But that way we'll make sure that Elissa makes it through her presentation. Thank you.
Yeah. And so it's not too long, but hopefully we'll be able just to touch on what the programs that we're offering, help you get to know a little bit about Ellie and I, and as well as see how we can be a resource, because really the Thompson Autism Center is about servicing our community here. So my name is Elissa Green Kaustinen, and my position at the center is called Directors of the Family Agencies and Schools Together program. I'm in a unique position that I am actually work for Chapman University's Thompson Policy Institute and consult at CHOC. So really in my role, it's to kind of support educating families, navigating the educational system. We are currently building a transition program that we'll get into, but really be out front facing, interacting with the community and supporting. A little bit about my history is I've worked for actually public school districts for around 17 years. Prior to leaving, I was a special education coordinator and worked for a local school district here in Newport Mesa Unified School District, and then left because this exciting opportunity, because one of the pieces I noticed was there was a piece missing between schools and the medical world being able to talk and actually speak the same language, because it's two very different worlds, but how confusing it could be to families and help them navigate. So I have been with the center coming on almost a year. It'll be a year in August. And prior to being an administrator for in a public school district, I was a school psychologist. So I started out my career in education as a school psychologist and then went into administration from there. Ellie, do you want to kind of briefly talk about you?
Hey, you guys. So my name is Ellie. That very long last name is Hodashodis, but just Ellie H. So what my job at the center is sort of unique as well. So I'm the outreach coordinator. So basically, I'm really help families get connected with community resources. So we really want to not only be there as the clinic, but be there as a support as well. We don't want to just say, hey, you know, now that you got diagnosed, you're on your own. So we want to make sure we're here helping families, pretty much holding your guys' hand throughout the whole process and through that transition age, to make sure that you guys really have all your answers, or questions answered, excuse me. And then a brief background about myself is that, oddly enough, I was in the school district as well for 17 years. I worked in the Placentia Yorba Linda School District as an aide, and then I also taught special education, mostly the severe behavior side of things. So my true passion is the adult transition age. Before I left the district, I was working with that 18 to 22-year-old population, really trying to get navigated into the world. There is a lot out there for the younger kids, but as the kiddos grow, there is sort of that, and I'm sure you guys know what I'm talking about, you sort of fit in those little niches that it's like, where am I supposed to technically be going? And so my passion came when I knew they were opening the center. I knew it's something that I had to make the leap and come on over to the Thompson Autism Center to just be there to help families find that, to, I guess, get out of that niche and to find your actual true home and adult life as well. So it's a little bit about me.
So looking at our center, what we'll cover today is we're just going to go over our clinical services briefly, talk about a little bit of research that is going on, as well as community education outreach, and then looking at our collaboration. We probably will try to spend more time on that community education and outreach, as well as collaboration, but we also, you know, we want everybody to be kind of familiar with what our services are, what we offer, and kind of how we can try to provide support through that. So looking at it, really our center came about because we wanted to address the gap in services. And so we all know, as many of you know, is about, early diagnosis. And so right now the time to diagnose is, reliable by 2. The average age is 4. And so we do really in our center, we want to try to close that gap and help that average age go younger. So we would like to help start supporting students and patients. And I apologize, I interchange students and patients all the time because I come from the school system. And so I'm trying to get over using students and I just don't know when that's going to happen. So I do apologize. But, really trying to close that gap of getting early intervention and getting those supports needed. We also want to help support, managing challenging behaviors, especially during, I think, this crazy time in our world, COVID-19. There's been an increase in challenging behaviors. Families had to really be working on their own, and we've seen that rise. And so we want to address that gap and be able to get that support for those challenging behaviors, as well as the comorbid conditions. What we've noticed, especially at our center, is that the lack of specialists specializing in autism, but also the need for an interdisciplinary team. And so it's not just your pediatrician working isolated, and then you have your neurologist, and then you've got your gastroenterologist, and then you have your psychologist, but really a place where there are all of your specialists working together and understanding what the treatment plan is and being able to address that. And so that's kind of looking at those really 3 areas of need. Our center has really tried to evolve and develop to be able to support those. So really when we look at our Autism Center services right now, and I know we're primarily talking to older transitioning. However, our services right now are really targeting 0 to 6. We want to start doing the interventions and get support for that. So we have 2 different clinics. We've got our confirmatory assessment clinic and then our comprehensive assessment clinic. So our confirmatory is where a doctor has diagnosed, they're not necessarily sure, and so they come meet with their neurologist, our pediatric neurologist, as well as a psychologist at the center, and they go through kind of confirmatory assessment and able to get, what are the next steps? What are those resources? The comprehensive assessment is when a CHOC pediatrician refers for more in-depth detailed assessment. And so that's where our psychologist, along with a pediatric neurologist, will assess and conduct a complete comprehensive assessment. Both of those, we are doing them in a day. So our confirmatory are shorter appointments, like 2 to 3 hours, where our comprehensive are anywhere from 4 to 6 hours. And so what we're wanting at our center is someone, if their child is going to be assessed, is they're able to come, get the assessment. There's a little bit of time where there's a team meeting, and then there's a meeting with the family of saying, okay, here's the next steps. So they kind of come that one day and they get kind of some of the answers they've been looking for, the referrals that are needed. We also do then have our managing difficult behaviors, so our challenge behavior unit. And that is where students or patients are having really a lot of difficulties. Our BCBA team will work with the private insurance or the insurance BCBA or the outside company and the families to navigate those behaviors, how to kind of support that student. We also do an ABA consultation to where it's helping them navigate, brainstorm. We just started recently a stopgap program, because what we've noticed is during this time, we are getting more referrals than we have staff for. And because of COVID, there's been a little lag in how fast we can hire personnel. And so the stopgap program is really to try to get in there, provide families with support, not necessarily the intensity of the challenging behavior unit, but more than just a consultation, because we also know that there's wait lists for ABA companies. And so the stopgap program is to really kind of be able to help get in there, help problem solve, and hopefully decrease those behaviors and help families feel supported. And then we also have a toilet training program that is ages 4 to 10, and that is at our center. We have rooms set up where there is a toilet and kind of a room where they work all day on training families on how to help support the toilet training process. And then when we look at our comprehensive care for comorbid conditions, and this is probably, I think, just a personal favorite of mine, because I feel working in this field so long, so many families are having to navigate so many different specialists. And with these co-occurring clinics, the neurologist, the pediatric neurologist, our specialists, so epilepsy, sleep disorders, GI, are able to kind of meet all together with a patient to kind of support that family. So yes, the appointment time is going to be longer, but you're also interacting with more specialists. You're not necessarily having to go from one facility to the next, but you've got a place where all of your specialists are, and they're in conversation. Another piece where we also have a dental program. So Healthy Smiles comes and does dental. They park their large bus. We are in the process of getting an orthodontist in the building, but they come and bring their large bus, and they're there. Ellie, is it one day a week or?
For Healthy Smiles?
Yes.
It's one day every other week. So one day every 2 weeks. And then now that we have sort of a break, Elissa, there is some questions in the chat. Oh, just so you're aware. No, I just didn't want to interrupt you, but at the same time, I wanted you to know there's a couple questions in there.
You know what? I was trying to.
Yeah. So Elissa, I
can't see it as I'm talking.
Yeah, since we're paused here. Oh, there was one question about if OCD support services or any other service are covered by insurance. You kind of talked a little bit about insurance, but people obviously are worried about the cost of treatment.
So we do have financial coordinators to where if there's a referral made, and we have financial coordinators who work with insurance companies. So I know that we take CalOptima. We take a lot of insurances. Ellie, can you answer?
So I know we take pretty much every insurance CHOC accepts. The majority of our patients are CalOptima, but that doesn't mean that's the only thing we accept.
A little bit of that as well. I'm not sure if you've had any interface.
Oh wait, can you guys hear me?
Yeah.
Okay, perfect. So it truly depends on the insurance company. We try to work with every insurance, and like Elissa stated, we do have those financial coordinators that once that referral is placed, we really try to work with your insurance to figure out sort of the way to get you in so it is covered by insurance. So it's hard to say if we have everything and everything is covered, because it just really depends on the insurance. But like I said, those financial coordinators, really, that's their entire job, is trying to figure out the niches and the ways to get you guys in based on your insurance, if that makes any sense.
Thanks, Ellie. And then Elissa, the other question, and we knew this was coming, was about services for adults. So people were wondering if any of these services if you had any services for adults.
So as of right now, I think our oldest patient is 19. We're really even focusing on, how long can we treat? Because that is one of our main concerns at the center, is truly that transition into adulthood and that medical kind of handoff, and how do we do that properly, and how do we not only, how can we do it properly with, right now, UCI is one of our main kind of partners where we hand off to the medical group, to UCI, because they do take CalOptima. That's a large portion of our patients. But Dr. Majirian, our chief medical officer, is also really focusing on how can we get just even general practitioners to be open and really willing and wanting to take on this population to where they're fully supported. So it's one of our key target areas. The main hospital at CHOC is really focusing on that medical transition of individuals. And so with high medical needs. And so the Autism Center, we're tacking onto that and really focusing on individuals with disabilities and how can we help provide them support. I assume that we probably will keep patients a little longer than we need to, but we're wanting to try to create a safe place and a place where we feel comfortable handing off that medical treatment, as well as families feel comfortable with the handoff.
Let me just
So
add one
unfortunately, right
thing,
now,
and
we're not-
then I'm going to add one thing, Elissa, and then let you continue. For those who didn't know, about a month ago, we had CalOptima in to discuss what their insurance coverages were for autism treatments as well as other things. And CalOptima, for those who don't know, is the primary insurance for someone on Medi-Cal or receiving SSI. So that's why it's so important for this population. So that session was recorded and we have a copy of the presentation. So if you are interested in more information on insurance coverage, I recommend that you watch that that recording. And okay, Elissa, I think you should move on.
No,
Yeah.
and you guys, I'm so sorry. We do have one more question. Can we just answer Nicole's question real quick?
Sure.
Okay. So Nicole, it's an excellent question. It's a question that when I answer it, I'm going to have to say I'm sorry. But at the moment, we're only accepting CHOC primary care referrals. So if your child has a CHOC physician or pediatrician, then they can refer your child on over to us. Right now, that's the only way. We're not accepting any outside referrals. And the reason why I say I'm sorry is because I know it's very frustrating. Again, I hate using COVID as an excuse, but the reason this happened is when COVID hit. So we opened the end of January 2020, and then we had to go remote beginning of March. And so we really could not build up the staff the way we would have liked to. We weren't on a hiring freeze, but it just was almost near impossible to get anyone on board. We weren't able to do in-person interviews, anything to that extent. So right now, we're strictly only taking those CHOC referrals.
Okay, and I'll add something, and I believe Elissa can add even more. The person wanted to understand whether UCI had an autism program. Yes, UCI, in partnership with Thompson as well, has the UCI Thompson Center for Autism and Neurological Disorders, I think is what it's called. It is on Red Hill in, I guess it's Santa Ana. It's kind of the border of Santa Ana, Tustin, and Irvine. And they are moving to more towards the UCI campus. I don't know, that's like what, in a year or so?
Mm-hmm.
Yeah, it's
and Elissa, you work there as well, right?
So I do not. We are in frequent consultation with UCI Center for Autism and Neurodevelopmental Disorder. But I have a counterpart, her name is Jean-Anne Carrier, who is the director of FAST over there. So Jean-Anne and I meet frequently and try to kind of run our programs consistently together, as well as we do have a lot of partnerships with them. So towards the end, I'll talk about our trainings that we do, and we rotate, 1 month there, 1 month we do it. So we will see sometimes some of the UCI patients just because they're coming from a CHOC physician or because there's a certain program, or vice versa. So we're not sisters, but kind of are. We work very highly collaboratively with them.
And I don't want to disappoint people. It's not my fault, but unfortunately there's an age group for the Thompson Autism, the UCI Thompson Autism Center, and I think it's up to age 22. And I know they're working on increasing the age, but I believe that is the current age group that they serve. And believe me, we all know that that's a problem. And I know that they're working on expanding that. Anything to add to that, Elissa?
No, and I think the thing is unfortunately, we're not at the point where we can service students patients who are older. But what I do want to say is it is a recognized high concern. And so it is something where our center, as well as discussing with UCI, along with talking with UCI's family physician residents, their director, she notices a large concern. So we're really trying to work with UCI to see how can we try to address this gap and how can we support these families, because, and I was a little bit shocked when I joined kind of more the medical side of things, and finding out that a lot of these families, their children age out. And then it's like, here's a psychiatrist. You no longer have the list of all the specialists that you need. And you're referred to somewhere. It's like, that's not what your child needs. And so we are trying to develop and support and train personnel who can support those individuals.
And I'll put the contact information in the chat, but let's let Elissa go on, and we can discuss a lot of these things after you're done, because this is what happens. It's just so easy to get into the discussion part, and let's let Elissa. So thank you.
And just because I kind of did go into more detail on some of these things I already spoke about, I won't go into it. And I do apologize. I meant to send this to Judy before I presented, so people would have a copy of this, but you'll have a copy of this presentation as well, just as an overview. So this goes into more of like the challenging behavior unit that I talked about, really those property destruction, self-injury, aggression. And so that's really where our challenging behavior unit comes in, and supports and the toilet training. I won't go that, because I do think, and I want to make sure this is valuable for all of your time, so I don't want to repeat myself. And I'll just talking about the research that we are doing, because we are trying to be, you know, our research center of excellence. And so we really want to partner, and we have been partnering with institutions, government, nonprofit industries. There's a close relationship with Chapman University and the Thompson Autism Center, as well as we have a sister center, the Thompson Autism Center in Missouri. And so we are doing some research with them, as well as Cornell, to try to really stay on top, engage, make sure we're utilizing the updated research. Our clinicians are, you know, looking at engaging and designing to develop and improve optimal behavior treatments that really will improve outcomes for children. We are partnering, and we'll get into some of it towards the end, looking at partnering with Vanderbilt to support driver's ed training. We're currently waiting to hear back regarding a grant. Vanderbilt has developed a driver's ed program, and we were one of the sites asked to apply to where we'd be able to implement this driver's ed program. It's a virtual driver's ed program. Obviously, it does not replace behind the wheel or different aspects, but it's to support and simulate the experience of driving to help individuals on the autism spectrum to be able to access and feel more comfortable, you know, getting and obtaining a driver's license, and so being on the road. Some of our current studies right now, we're working with Chapman University with the impacts of the COVID-19 on students and their families, signs of autism via early infant feeding behaviors. And so that's with Dr. Katz, one of our GI specialists, in collaboration with the Autism Center. We've done a telehealth satisfaction survey. So looking at how, because most of our patients, unfortunately, since we've opened, have been telehealth. And so looking at how can we improve, how is it going? And the great information that we've gotten back is that, you know, some families for certain things want to stay telehealth. I'm not sure if you guys have had that experience or not. And then we're realizing, you know, yes, we can do a mixture of telehealth and in person. And so we've started increasing more in person lately, which is great. We're also doing a oral health retrospective study with Healthy Smiles and Dr. Majarian, who's our chief medical officer. Some of our pending ones research is the COVID-19 and neurodevelopmental disorders with the center. And it's a collaboration between Dr. Majarian at the Thompson Autism Center, the Autism Center, Thompson Autism Center, Missouri, as well as the Center for Autism and the Developing Brain Wealth out of Cornell. There's another one that we've got a couple other studies. I don't know what they stand for. It's called SAT2, and that is sponsored by Dr. Tarman, and then Dr. Gola is doing an LA170 study. So unfortunately, just because they're a little more technical, I don't know a lot about them, but I was told that those are our recent new studies that we're starting to get into. So looking at more of the outreach and community things, there's our program, the Families, Agencies, and School Together, so the program that I oversee. And, you know, I service preschool to 22, one of the pieces in my role, and it's nice because I'm with Chapman University, as well as with the Autism Center, is helping families support them transition into college. And so I'm working very closely with the Tutor and Learning Center as well as the Disability Center at Chapman to look at how can we build a robust program to support individuals who are on the autism spectrum, and not necessarily even the spectrum, but that have any neurodevelopmental disorder, because there is, I think, a lot of confusion and trying to understand what is, here's my child's IEP, what can they get, what types of supports can they get. And so with my role, I've really tried to bring various aspects of that transition into post-secondary education to how can we support these individuals where they're successful. And looking at a lot of campuses, their population is becoming more and more neurodiverse. And so how can we help these individuals become successful, as well as how can parents kind of help support that movement forward too? With the families, agencies, and schools together, it's a collaborative relationship between trying to partner with the medical world, the public education or the education, school, family, and then the agency partners that can also support it. And so trying to look at it as a whole, because most of our children, they're not raised in isolation, but it takes a village to raise any child. And so helping families, because it can feel isolating when you do have a child who has a neurodevelopmental disorder, and navigating all of the resources out there, but looking at how can you partner with all that is there, because it can be so supportive when it works together and is cohesive. And so in my role, I work with school districts. I've worked with here in Orange County, the Orange County Department of Education. I've consulted some with some private schools and some of their individuals with disabilities to talk to them about how can they support, as well as what are some of the things that can be done in that. So really looking at that partnership. We also offer educational workshops, which I'll get into in a little bit, as well as we held it back in April. We held our first resource fair virtually, and it was a success. We got a lot of positive feedbacks from families. And one of the pieces that we heard loud and clear was more support for individuals who are transitioned. So looking at 18 and older, 18 into adulthood. And so our resource fair on August 21st is focusing solely on transitioning youth. So transitioning into that adulthood, what supports are there, what resources, looking at activities, looking at colleges. So trying to get all of that information in a place where families can come and navigate that. So Ellie, I don't know, just because I can't access my chat since I'm sharing my screen, can you put our registration link, and Judy will also send this to you as well. So if you're interested, please register. It's actually a nice thing. You can pop in and out of rooms, our Zoom rooms, and have conversations. It's not necessarily a private conversation because families pop in and out, but you're able to find out, is this a resource that meets our needs? And it's a nice way to kind of get information in a short period of time. So it is roughly we extended it because we were told our 2 hours was too short. And so we extended it by an hour to hopefully be able to connect families to resources. Another piece that I accidentally left off of here is that we have our resource specialists that I think is so unique to our center, in the sense that in our co-occurring appointments, our resource specialist, and even Ellie, who is our outreach coordinator, goes into these co-occurring appointments with families, and they talk about what their needs are. And then our resource specialist is able to research and even take a look and say, okay, this is your insurance. Here's some ABA companies that work, or here's some resources that you need. And so we're able to really connect families without a long lag time. One of my favorite pieces is also in those co-occurring meetings is I'm able to go into those meetings as well and support families with their understand the educational system, and trying to understand, taking a look at the IEP, consulting with them, and hearing what the family's ultimate goals are for their individual. And then how can we help relay that to the IEP team? How can we clear up some miscommunications that way? So it's a great, I think, unique thing to our center, and the fact that families and our patients can come and kind of get a lot of their information and that better word without having to spend hours of spending and kind of researching. So we do have a fabulous resource team really led by Ellie there as our outreach coordinator who reaches out and, supports various, agencies and seeing how we connect those resources. And Judy is one of the ones that we also give to families because it is such a fabulous resource for them. So with the FAST program, and I apologize, I talk a lot, and so I talk over slides, and so I'll try not to do it. But FAST is a partnership with the Thompson Policy Institute at Chapman, along with the Thompson Autism Center. And so really the goal is to support families in understanding and navigating the special education process, build collaborative and effective family-school relationships, and increase knowledge and skills of school and community-based service providers. So just to understand the FAST supports, we do educational workshops, parent resources, individualized consultation. Currently, we are running a social skills group through iSocial, which is a virtual social skills group that was created out of the University of Missouri. And that the transition, so Journey is our transition to adulthood program, and I'll talk more on that a little bit later. But the way we support agencies is I do consult with them regarding individual students based or kind of individual or just a general consultation and professional development. With schools, they will consult on personalized consultation, professional development, program development, as well as participate in IEPs. I'm not a advocate, but I will support the process and help navigate those systems. Judy, did you have, I just saw you unmute.
Yeah, what I wanted to ask is, all this programming that you have here, that's beyond just treatment. Yeah. Is that available to the general population, or is this limited to people being served by the CHOC Autism Center?
Right now it is the CHOC Autism Center. If there is certain individual cases that kind of need some support and they want to reach out to me, I'm happy to kind of just do a brief consultation or kind of connect with resources. But mainly my referrals come through the Autism Center or I would say the hospital, because I've also gotten referrals from CHOC from different departments, just in the needs from the social workers because individuals need support. But I'm happy kind of for your group, if there are individuals who need some support, or educational workshops for families are open to anyone. Our iSocial group right now, it is a pilot. And so if that is well, and it is successful, we notice we're going to run 2 pilot groups. We will probably just open it up, very similar to peers. So our center also runs peers right now. And so I think we're on Ellie, is it our second cohort going through peers?
Yeah, our second.
Yeah. So I think once we kind of see like, okay, this program's successful, then kind of gets opened up a little bit. I believe the peers is open to anyone, correct? Or is it just open to our clients?
No, anyone. And as long as they have a diagnosis of autism, okay, where we're accepting anybody.
And are you doing both groups? I know there's like a teen group and then the adult group. Are you doing both teen and adult, or just teen at this point?
Right now we're doing teens, but that is strictly just because that's what we've had reach out to us. It's not really that we don't want to do the adults. It's just that thus far we've had families with teens reach out, but I know our psychologists are trained to give both the teens and adults. So
okay,
anybody can sign up, of course. And then as far as the resources go, if anybody has resource needs, my coworker Sandy and I, we're here to help anybody and everyone. So you don't have to just be a CHOC patient. You can just be, I don't know, Joe from up the street, and we can help you with any form of resources you may need as well.
That's great. I will definitely, I know I get referred to, but I'm going to definitely call you up, Ellie, because I get them all questions all the time. So that sounds great.
Oh, yeah, excellent. Perfect.
So here's kind of our educational workshops right now. So we do, in collaboration with UCI's CAND, and anybody can attend this, is our Autism 101. And so it's currently provided virtually, and I think we will be for a while at least doing it virtually. I'm not sure. We've had families where it's been beneficial And so we are looking at kind of creating more of an even an on-demand one. But it rotates between UCI and then our center. Is UCI next month or is it our center, Ellie? You may not know.
Next month is UCI. Well, the end of this month is UCI. August is our center.
And those can be accessed on our website as well. And every other month, we also will offer a special education 101. And Judy, if there is, I think the piece when we look at older families, a lot of times that special education 101 is not needed. But if there is something where we want to take a look at doing something a little more different, we definitely can. One of the educational workshops that we will be presenting at, or I'll be presenting at, in addition with Jason McAlexander, who is the Disability Center Director at Chapman University, will be presenting at UCI's canned transition conference, or their annual conference that's happening in October, but it's focused all on transition services and how to support. So we'll be talking about kind of that college transition and how to support your child in that.
That's great. I know that a number of our parents are really interested in some assistance on the IEP process. So maybe that's something we can figure out together.
Glad to help with that. And Jason and I are working on, because so as the director, he sees all the IEPs come in, and, you know, really he's been able to support a lot of individuals, and they've had just a growing population at Chapman, as well as what's been successful, what has not been successful. And so, you know, when we present in October, we'll really look at, and we can maybe talk a little bit more later, just about how to support the individuals, because there is a way, there is really, and that's kind of where we focus in a perfect segment to our Journey program. So it's our Journey to Adulthood transition program, and really focusing on that person-driven planning process. And so we started this, I want to say about 2 months ago. We've had roughly 8 individuals who have gone through it or going through the process. And we start with a pre-person-driven planning meeting. And so really to talk about, kind of explain what the process is, how it's supposed to help navigate the transition process for our families and individuals with disabilities, and talk about their fears, their dreams, you know, what are some of the barriers, and not just look at, because schools do some of this when they do their ITPs, so their individualized transition plans. However, you know, schools have a lot. And so I think they do the best that they can, and they are able to touch on, but really schools need a partner. And that's where our Journey to Adulthood program comes in. We want to partner with schools and with Regional Center and Department of Rehab. And so it's been great because Regional Center and the school districts have participated in our person-driven planning process. And we will conduct interviews with the individual that we're talking about, so the patient, as well as with the families. And then I made a typo, so I'll correct that before I send it off. We hold our PDP meeting, and then an action plan is developed out of that. And so in the action plan, really talk about who's doing what. And it's not necessarily for families to be like, oh, you're held accountable for this, but it's really like, here's the next steps. And we meet after the action plan meeting, we go over it, we adjust it, and the center staff, some of it's responsible for it, some of the schools responsible for pieces of it. Regional Centers responsible for it, as well as families, but it gets families to start talking and thinking about various things. And so when we check back in 6 months after doing it and implementing it, we make tweaks and changes, and wanting to make sure that this process is successful. So since we haven't been doing this for 6 months yet, we haven't had that first 6 months check-in, but really we're working with some consultants who are known in the transition world and have done a lot of work in this. And so they've been great through our process, leading us and really trying to support families. Some of the pieces that we are looking at developing in probably more of like an on-demand way virtually, and then hopefully some in person, is, you know, some life skills training, looking at alternatives conservatorship, looking at even just educating families on a transition plan. What is it that the school's responsible for? What's an expectation? Looking at financial planning, independent, dependent living. So kind of exploring and talking about all of the things that surround transition employment skills, those types of things. We're also developing transition milestones because at the center, we do believe that when you start transitioning adulthood, it's at birth. Because as you transition, it's not just like all of a sudden I go from this to this, but it's those slow incremental pieces. And so we're working on building with our psychologist, our pediatrician, as well as our consultants, these handouts that at different ages, so preschool, so 0 to 3 preschool, elementary, middle school, high school, what are ways that families can support their individuals in transitioning? Because there does need to be that gradual release of independence and building independence. And if your individual can or cannot do a skill, okay, what's the prerequisite skill? What can we work on? So we're developing those by the end of the summer. That should be finalized and ready to go out, as well as we're continuing to build relationships with local resources and what those resources are, because as an individual transitions into adulthood, nobody does it by themselves. And so looking at who are the teams, who are the resources, who are the connections that will be key in making it. And so, yes, you can have a child or an individual with a disability who's higher functioning, you can have an individual who's lower functioning. And so those resources are going to be different, and they're not going to necessarily be the same. And so really trying to connect families and individuals with those resources to make a roadmap. And, right now I think of it, there's so many things as you become an adult that you have to navigate and try to learn out and figure out. But our team is really there to support and help smooth out that road and create a map of like, okay, this is where we think we're going. Doesn't mean that we can't take a different turn, but to really help families through that process. And so a lot of our partnerships, I would say, at our center is we work closely with the Center for Autism and Neurodevelopmental Disorders, and that's at UCI. With our, birth to 5, we work with Help Me Grow, connecting with resources. Chapman University's Thompson Policy Institute has been key in our consultants with our transition program, as well as supporting any research. iSocial for some of our social skills. Vanderbilt's, looking at that driver's ed program that hopefully we'll hear about soon, that we can start implementing and offering. Obviously, individuals have to be 16 or older, but it's something that we're very excited about. We've held some social skills group with the TLC Public Charter School, as well as the Thompson Center for Autism and the Neurodevelopmental Disorders out of Missouri. Here is my and Ellie's contact information. We can put it in the chat, as well as I will be sending the PowerPoint, out. I will stop sharing my screen.